and to remember that, again, we are looking to save lives. But as a clinician, it is difficult as professionals in this field, because it's not just us. Also thinking about the complexity of policy, the complexity of potentially working in an agency that is receiving funding from the federal government, and the federal government's view of what addiction treatment should look like versus what, we're trying to provide versus receiving state funding. Like for instance, we are now in a state that has legalized marijuana, but you might be an agency receiving, dollars from the federal government who does not recognize the legalization of that. And, we might be working as providers, but this individual we're serving is working, with a legal entity that says, no, you're not allowed to use anything. Because if you use a substance, you might be incarcerated, and this is not to say any of those entities are bad. This is just to show and highlight the complexity of modalities like harm reduction and motivational interviewing. It's not just a choice, but it's also a complex measure when it comes to how we deliver that service. And that's why, again, we encourage everyone to first and foremost educate, like Dr. LaPietra said. If you look at the science, if you look at the research, it does show that these methodologies work much better when it comes to the change process, but also look at the context and the limitations that that entities have sometimes put into place. And again, it can start as simple as just giving safe spaces and normalizing that dialogue and normalizing it. Because again, when we can talk about addiction like we talk about any other medical condition, it will allow so much more viewable access and normalization to getting help and support, and having different avenues of what that support can look like, and preventing that rigidity of treatment has to look this way, and if it doesn't, then that's your choice, then good luck elsewhere. We just want to open as many doors as possible, because what we are seeing is, by giving people the empowerment to make a decision in their own recovery, it empowers them to make change for themselves, as opposed to us pushing that change onto them. And that's what can really help continue and motivate someone on that process and on that journey of their recovery and wellness.